A quote from the letter the Chancellor, Jeremy Hunt, wrote to the Governor of the Bank of England after yesterday's interest rate hike. As we focus on getting inflation down, we will continue to ensure that fiscal policy remains aligned to monetary policy by controlling public sector borrowing. And he added, it is also vital that medium-term fiscal policies, including public sector pay awards, be based on the expectation of full achievement of the inflation target. Well, that hasn't stopped junior doctors pushing their pay demand for an increase of 35%. They're coming out again next month, and the 5-day strike they announced this morning will mark a significant escalation in their campaign. The strike will run from July the 13th to 18th. Dr. Vivek Trivedi is the co-chair of the BMA Junior Doctors Committee. Good afternoon.
Good afternoon. Thanks for having me.
And against that background, against the determination of the government to keep pay down because of the implications or possible implications for inflation, you really are fighting this battle at the worst possible time, aren't you?
Well, it's nonsense, really. There's multiple economists, senior economists from different industries who've rebutted this claim that public sector pay leads to inflation, because it's completely different. Private sectors, when they raise their wages, that adds costs to prices, but it's just not the same thing for public sector workers. And there's a huge gap already between private sector pay and public sector pay. And all we're asking for is doctors who are paid £14 an hour right now to be paid £19 to £20 an hour. That's not going to break the bank. It's not going to lead to a wage spiral inflation. It's simply going to restore our workforce so that we can go back to providing good quality care to patients as we once were.
Well, that's a view, and I know there is a degree of controversy on the question of whether public sector pay increases do indeed feed through into inflation. But the fact is that the government believes that they do, and you heard that quote from Jeremy Hunt yesterday. There's not a chance they're going to give you an award of the sort of level that you're looking for, is there?
But even common sense would show that claim doesn't hold any ground. Inflation has been soaring recently because of supply chain issues. Public sector pay has been stifled, but inflation has still risen. So why would public sector pay have an impact on inflation that they're describing? And what we're asking for, the cost to restore our pay, to reverse the pay cuts that have been inflicted upon us over the last 15 years, would be about £1 billion or so, which is a small drop in the ocean for what the Treasury hold and what their overall budget is. It's a political choice whether the government want to appropriately fund a healthcare system or underfund it and wages, but then they have to be honest with the public that comes with a poor standard of care.
Do you worry that you look like outliers increasingly? I mean, it appears that the nurses' strike is going to disappear possibly because not enough people voted in the latest ballot, which really leaves you standing on your own.
Not at all. So there's various other public sectors who've been held down by our government's actions over the last 10 to 15 years. And there's multiple others that are within pay disputes of their own, which brings us to the same conclusion that, everyone's made the same calculation. Their pay has been stifled. That's led to negative consequences in these various sectors. And we need to do something to fix that. Now, doctors have had some of the worst real terms pay cuts, with ours, the doctors I represent, having lost more than 30% of their pay in real terms over the last 15 years. And what that means is doctors are being poached away, and they're going away to places like Australia and New Zealand, and we need to do something to stop that.
Dr. Trivedi, thank you very much indeed for that. Listening to it, Nick Hulme, who's the Chief Executive of Ipswich and Colchester Hospitals, good afternoon to you.
Good afternoon.
What impact do you think this strike, this 5-day strike, longer than any we've had so far, is going to have on the way your hospitals operate?
It's going to have a huge impact. This escalation is disappointing for everybody, really, but most of all for our patients, because although we will manage and we will keep our emergency services and our 24/7 services safe, this will have a massive impact on the thousands and thousands of patients waiting for operations, waiting for diagnostic tests, and will come on top of waiting times which are already far too long post-pandemic. So this will not be insignificant, as I say, comes on top of months of delaying patients already because of industrial actions.
Can you be a bit more precise about the impact? I mean, is it simply going to delay things, or is it going to put some patients in real jeopardy because of the delay?
We're very careful at looking through our clinical panels to make sure that those patients who are at greatest risk of having their operation delayed or postponed are treated. We are seeing more people come back to work. We have been able in the last set of industrial action a couple of weeks ago to provide more care to patients in theatres through operations and through outpatients. So although we have a very clear and precise way of managing the risk, there is no doubt that the longer these strikes go on, the greater the risk there is to patients. not only clinically, but the massive disruption it causes to patients when they've planned their lives around a planned clinical event, whether it's a day surgery or an operation or a diagnostic test, to have that then cancelled, to then be postponed, to then move into a slot already taken by somebody else. So the knock-on effect or the domino effect of several patients, not just the ones on the days of strike, but for the subsequent weeks and months, will cause significant distress to patients.
Do you have any sympathy with the case that we've just heard made by Dr. Trivedi, particularly his point that more and more junior doctors, people trained in this country, are likely to move abroad if the fundamental problem with their pay isn't sorted out?
We clearly need to do everything we can to retain those members of any clinical group who we've spent a huge amount of money and time investing in developing them and training them, getting them their qualifications, supporting them through their training, and indeed them supporting us through delivery of care. We need to do everything to retain the best staff. And we know that pay is one issue that does affect whether or not we retain staff.
Well, that's what it's a bit mildly. It's hugely important to retaining staff, I would have thought.
There are other. It is one aspect, but we also know how staff feel about their work, whether or not they feel supported in their work, whether or not they feel valued in their work, and all of those issues are important. I think for me the most important thing is that we find a quick solution. I'd implore all sides, the government and the BMA, to get round the table to find a solution. It has to happen quickly. It has to be fair and equitable in terms of other clinical groups and other public sector workers, that we don't potentially make an exception for one group. It has to feel fair for the junior doctors. I talk to junior doctors. I understand their anger, and it has to be affordable. The £1 billion that was talked about just earlier by the junior doctor, that's a huge amount of money that would have to come from Treasury, because the NHS within itself couldn't afford that without significant impact on the care of our patients.
Hulme, thank you very much indeed for joining us. Coming up, has